Hello everyone, the disposable umbilical cord clamp sys or CSAP rod UC10. Dependent light velo PED and patented by Weigao Zheisheng Medical Devic. ESCO Ltd. The product consists of umbilical cord clamp scissors and umbilical protection pad. WEGO audio help the medical staff quickly understand through WEGO umbilical cord clamp scissors product. The following will share the 3 steps for correct use of WEGO umbilical cord clamp scissors. 1. Positioning. Head and do of the newborn towards the operator. The umbilical cord clamp sys or C-sign in 90 vertical position with the umbilical cord off the newborn. Place the umbilical cord at the top. Off the groove off the umbilical cord clamp. Reserve the stance of 115 centimeters. Between finer edge of umbilical cord clamp and neonatal umbilical cord will. To cut. Use the DH in a row or right hand to hold the anti-skid protrusion off the umbilical cord clamp scissors. Hold the front end of the umbilical cord clamp scissors with your left hand, and the handle off the umbilical cord clamp scissors with your right hand and exert force at the same time. Cut and clamp the umbilical cord and remove the remainder of the product and the umbilical cord ligation. Check whether the end of newborn umbilical cord is clamped and whether the race blood seepage, and routinely disinfect the umbilical cord incision. Place the umbilical road CDI on pod under the umbilical cord clamp with the opening facing upward. Fix and wrap the umbilicus with umbilicus protection pad. 3. Remove the clamp. The umbilical cord clamp is usually removed 24 hours after delivery. Clamp opener also in on fully inserted of umbilical clamp ring. Cut their inga after the clamp open areas insert it in place. Routine disinfection of the umbilical cord at the area valve of the umbilical clamp. In case of umbilical cord edema, excessive colic, the umbilical cord clamp can be removed according to the EDRY-ness of the umbilical cord, or a SDI directed by the doctor.